Thank you, Mr. Chairman. And the testimony was very good today. You know, we spent a lot of time in this committee gathering data over the last few years about how we're in a growth gap. The economy's underperforming. It's the slowest economic recovery ever. And wages are flat. Small businesses have really struggled. For the first time in 35 years, more businesses have failed than have started. And on top of that, we've got the medical device tax, some very powerful testimony we've heard today that is hurting one of our best American success stories. And, you know, I think one thing to just reflect on is that 80% of medical device companies are small businesses, 50 employees or less. And sadly, some of the stories that I've heard match the story, Mr. Hoghaug, that you mentioned of the impact on these device manufacturers. I talked to a company in Texas. They had never laid off an employee in 22 years, but they laid off 25 people, and then they deferred hiring another 15 people simply because of the device tax. And I hear other stories all the time in my home state of Minnesota, as Senator Klobuchar knows. And Mr. Hoghaug, you mentioned that in your written testimony, and you kind of got this a little bit with cash flow issues, in your written testimony, it mentions your effective tax rate as a company at Signus Medical is nearly 79%. You face one of the highest tax rates of any industry now in the world. I mean, it's surprising to me that you're still in business, and how can any of us sitting in front of you expect that you can continue running your business like that? Now, some claim that by the Congressional Research Service and others and supporters of the tax claim, there's no impact on jobs. It's not real. It's not really happening. As someone who's actually running a small business, Mr. Hoghaug, and understands what's happening on the ground, how do you respond to those critics?
Well, a great question. In theory, most of these studies that I've seen or read, it's all based on the fact that you can pass on this 2.3% to the actual end user. That is not my experience. We have not been able to. I haven't seen anything but a decrease in actual pricing since 2008. We're down about 70%, and thus profits are down. You tack on the 2.3% on top of that, and the cash has to come from somewhere. And as I mentioned in my testimony, one of the hardest things I ever had to do was walk up and lay off 2 people for the sole reason that I had to make my tax payment. Not because they were doing anything wrong, they were exemplary employees, but I had to lay them off, otherwise I'd be in default. And that's very real, and I haven't been able to hire them back because we're paying 50, 60 days in advance of collecting the actual money on a sale. So you're always playing catch-up with the cash, but the bills always come in on time.
Now, you mentioned also that you've deferred or had to shelve some research and development products, and the surveys we've gotten back from the device industry says the exact same thing. And this is the lifeblood of the industry, right? I mean, it feeds into the supply chain of where we've seen all the success. Can you tell us a little bit about some of the patients that your devices have helped, and what's the impact of the device tax now on them?
Well, I have hundreds of stories of benefiting. One that actually has stuck with me for many years is a father bringing in a 16-month-old small child who was quadriplegic due to Down syndrome and a congenital defect at the base of the skull, and carrying his small daughter into the neurosurgeon I work with in Children's Minneapolis and saying, please, please bring my daughter back to me. And through the course of the surgery and implantation of our device, I was witness to the fact that she could move her fingers and her legs again, and while still has many, many challenges ahead, she was functional, and there wasn't a dry eye in the house. But those are the types of implants, and the next generation implant that could be out there to help more people, a greater number of patients, the research and development dollars just aren't there to take it to the next generation to supply it.
Well, I think that illustrates how this is really a tax on innovation. And as the Chairman knows, coming from a state with a high propensity of medical device companies, and Senator Klobuchar knows, we need to keep this industry alive. And thankfully, this is one of those issues that has gathered bipartisan support for repeal, and I hope that we'll continue to be able to move this issue forward, and I would yield back.